Good day, everyone. My name is Samuel Faloye. I'm from the Varsity College, Wasville, Durban, South Africa. I'll be presenting the paper titled Factors Affecting eHealth Adoption in South African Public Hospitals, Case of KwaZulu-Natal Province. The study was conducted between the year 2019 and 2020. The data for this study was conducted in 2020. The structure of my presentation is as follows. The next chapter will present the motivation for the study, followed by the research objectives, the research approach, the conceptual model, the major findings, conclusion and outlook, and lastly, acknowledgement. The literature has shown that there have been major challenges to eHealth adoption among developing countries. South Africa is listed in the countries that have been struggling with eHealth adoption. And this is because eHealth project designer often focus more on the benefits that come with the adoption of eHealth and they pay less attention to the challenges that hinder the successful implementation of eHealth. Studies have been conducted to identify eHealth adoption challenges so as to improve its adoption. However, eHealth adoption in South Africa has remained on the lower side due to insufficient studies that focus on identifying challenges that are associated with the adoption of eHealth. Another motivation for this study is the inefficiency in South African public health sector. Based on the problem statement and the conceptual framework adopted for this study, following are the research objectives of this study. To determine the extent to which the performance expectancy of an eHealth system may influence its adoption and use at public hospitals. 2. To determine the extent to which effort expectancy of an eHealth system may influence its adoption and use at public hospitals. Finally, to determine the facilitating conditions that may influence the adoption and use of an eHealth system at public hospitals. Descriptive research design was implemented for this study. A quantitative research methodology was also implemented. The target population for this study was Edendale Hospital professional staff member, and the target population contained about 893 staff members. The sample size required for this study, based on Craigsy and Morgan sampling table, was 265. A stratified sampling technique was used to select the sample. To assess the reliability of the research instrument, a Kronberg alpha coefficient was assessed, and a 0.794 value was obtained, which implies a reliable research instrument. The data obtained was coded through Microsoft Excel and was further exported into SPSS for data analysis. This study adopted the Untitled model. The construct of the model are as follows: behavioral intention, performance expectancy, effort expectancy, social influence, and facilitating conditions. The application of this construct are as follows: performance expectancy. In the context of this study, the performance expectancy is the degree to which healthcare staff believe that the use of eHealth system will enable them to attain and improve productivity and quality service. And based on this model, performance expectancy has a direct relevance to the adoption and use of eHealth system for improved service delivery. Therefore, if healthcare staff perceive that The use of eHealth will positively enhance the health service delivered. They may be favorably disposed using it. Facilitating conditions. This construct was used to assess the degree to which healthcare staff believe that the organization resources and technical infrastructure exist to support the effective use of eHealth systems. These may determine whether they will adopt the eHealth or not. Behavioral intention. In the scope of this study, the behavioral intention refers to the extent to which someone has conscious plan to undertake or not undertake a specified task in the future. This construct was used to investigate the willingness of healthcare staff to adopt and use eHealth system more frequently or in the future. The findings from this study show that healthcare professionals expect an eHealth system to achieve an accurate patient diagnosis, improve patient awareness regarding their health, produce quality health-related information, improve quality of safety at healthcare centers, and ensure data privacy and security as compared to manual health systems. The findings also show that there's a significant relationship between the healthcare professional performance expectancy of health system and their behavioral intention to use health systems. The findings from this study also show that most respondents believe that health systems are easy to access and use. And this is an important result because if e-health professionals find it easy to access and use e-health systems, there's a good chance that they will want to keep using it. In addition, a high percentage of the respondents indicated that they will adopt e-health system if it was web-friendly, and this result indicate that the slow adoption and lack of continued use of e-health system in hospital may be related to the user friendliness of the system and the applications on the web. The findings also show that the lack of ICT infrastructures affect the use of e-health systems. In addition, the cost of the internet is a restriction to the adoption and use of e-health systems. The result of this study also showed that a high percentage of the respondents believe that if they were able to receive computer skills training, this will promote the use of e-health systems. And finally, most of the respondents in this study indicated that government support is crucial for the adoption of e-health in public institutions. The availability and functionality of the infrastructure needed for e-health system can be improved if there is support from the government. In conclusion, there's been low adoption of e-health in South Africa, and based on the findings obtained from this study, the presence of facilitated conditions, adequate ICT infrastructure, relevant computer skills training, government support, and involvement of hospital management would encourage healthcare professionals to adopt and use e-health system. I would like to thank my supervisor for his guidance, Dr. Nuruddin Ajayi, and also I would like to appreciate the Varsity College and University of KwaZulu-Natal for giving me the opportunity to conduct the study. And this is the end of the presentation. Thank you, everyone.